So anyway, my name is Gail, and this wonderful doctor saved my life. And if it wasn't for him, I may not be standing here right now, because I went to so many dermatologists. It looked like a little brown sunspot, and I also wanted to let you know that I'm also a member of this, and it's amazing. But long story short, I had it lasered, I had it burned, I had it creamed, they did it, and nothing happened. So I went on this for years. So I thought, okay, forget it, it's not going away. And I thought nothing of it, because a melanoma, normally when you see it in a picture, it's brown and it's got like a red area in it, and it just looks gross. So I didn't think anything of it. So I thought to myself, and actually I have a medical background. I'm a previous CT scan technologist, so I've worked with many doctors, and I know a lot about things like that. So, and I've always taken care of myself. So long story short, I thought, screw it. I said to my husband after 25 years, I said, I had this double chin that was like always going on in my family. It was, I'm so sorry. I thought, I'm just gonna go and have this done and make myself feel better. So when I walked into Dr. Summers' office, and he looked at this spot, and it came back 2nd degree melanoma, correct? You can help me with this.
You're doing great.
Okay. They literally, I mean, I wished we had the pictures to show you. They had to take out my whole entire cheek 3 times. The first time, surgical oncologist, thankfully, he knew somebody wonderful. He removed it. My face was opened with a cotton ball for a week, okay? So they thought they'd make sure everything was clear. And I'm on this drug called prednisone because I have other health issues, and that's why I had to kind of stop working. But my skin is very thin, like he was discussing in some of the presentation. So he had to literally close the gap from here to here to close the cheek to start it to mend. So about maybe a couple weeks later, Dr. Summers checked me, and he noticed another little spot. Well, apparently more cells came back from the melanoma, so they had to reopen it again, completely open this entire cheek, and to make sure all the margins were clear. Thankfully, it came back, I believe, negative, right? So then we had to go through the procedure of actually reconstructing my face. And I may have the makeup on and all of this, but Dr. Summers and the girls all in the back all know that I am not a mirror person. I'm not the type that, I'm nervous, so I'm really sorry. I'm not the type of person that is, I'm out there, I look great. I do it because I have a very low self-esteem, and he knows this, and every time he's showing me what he's doing, I said, look, I don't care, because I trust you with everything, and that just do what you have to do. So anyway, if you don't mind, I just want to read what I wrote, because I know it's going to be very emotional about this, because like I said, if it wasn't for him, I could either be in chemo right now or gone. They took out 2 lymph nodes. Thankfully, everything was clear, and I am cancer-free.